So I know it's not bone health day or week or month, but I've seen so many patients recently at the clinic who have fractures without really truly having bad fall or injuries. We're so used to seeing all these in older people, but we're seeing more and more in the younger generation now. So I just feel compelled to do something on bone health, and hence my last few reels have also been on this. I'm going to do a little longer one explaining to you how really this happens and what, more importantly, what we can do to therefore increase our bone strength. So let's first understand what bones really are made up of. 50% of our bones are actually collagen. The remaining is calcium, magnesium, boron, vitamin K, and that makes your bone strong. They also make the bone slightly flexible, which means if you hit yourself or if you have a fall, the bones have the tendency and they have the capacity to be a little flexible, and they can actually move a little and then they come back to its original form. But when your bones are brittle, when you have osteopenia or you have osteoporosis, osteoporosis is nothing but brittle bones. Osteopenia means you're getting there. And when that happens, when you have osteoporosis, is when you actually don't knock yourself as badly or don't have a really bad fall or injury, and yet you break your bones because they cease to be flexible. Now your bones are a living tissue, and this living tissue is constantly being remodeled, and it's doing so essentially with two cells. You have osteoclasts and osteoblasts. Now osteoclasts are the cells that cause a breakdown, and osteoblasts then go and remodel it, strengthening the matrix of the bone. And it's the conjunction of this osteoclast and osteoblast, the formation and the breakdown, when it's done correctly, that you get strong bone. There are several risk factors which can actually push you towards having weak bones and osteopenia and porosis, and I've covered most of these on my Instagram page, but just to enumerate a few of them. If you're someone who's smoking or having more than say 2 drinks a day, especially for people who are having soft drinks, which we know reduce phosphoric acid and weaken bones, or if you're somebody with a bad lifestyle and eats a lot of processed food, you don't get sunlight and you don't get vitamin D, these will all push you towards having brittle bones and osteoporosis. There are also lots of medications that can actually worsen bone health, especially the medicines that are taken over a long term. So chronic use of steroids, topical or oral, even certain antacids, be it the PPIs or the H2 blockers, they can also worsen bones. You can have certain SSRIs, certain antipsychiatric medication, which can all worsen bone health. So be very careful when you're taking these and speak to your doctor. You might need to continue taking these medications, but you can also do what it takes to improve your bone health and make sure it doesn't suffer. Now, if you're looking to strengthen your bones, as you should, then these are the things that you should follow.